Hello, everybody. Good evening, good morning, and also good afternoon. Thank you, ladies and gentlemen, for joining this webinar session. We are on the series of virtual postgraduate info week, whereby today we are focusing on health informatics and analytics. So please allow us to bring to you the topic for today, unraveling the journey of postgraduate studies in health informatics and analytics. So, hi everyone again. I am Dr. Yam Waikit. I'm the Program Director for Postgraduate Health Informatics and Analytics in IMU. Together with me, I have a few panels with me. But before we move on to the next few panels, please allow me to share with you some of the housekeeping rules that we have. If you can see from here, basically we have muted the microphone for all of the attendees in this session. And if you have any questions or even feedback regarding to the program or even anything that you would like to ask, please use the Q&A panel, which I believe you can see in your Zoom. And this live webinar will be recorded. So for your information, we are recording this session, yeah? So I'm going to start the session now. I'm going to stop sharing because today we plan to run this webinar session with a very interactive way whereby we wanted to do like a forum kind of discussion. So rather than just go through some of the topics that how we usually do this kind of info week and all. So we thought today we probably can change the style a little bit by doing some sort of like a forum type. So the idea is very simple. Today, I invited a few speakers here, and they are all at various stages in HIA, in Health Informatics and Analytics. And from now on, I'm going to use HIA to talk about Health Informatics and Analytics. So, namely, I have three speakers here at this session. I have Dr. Noraini, who is already an alumni of our MHIA, our Masters of Health Informatics and Analytics. She graduated last year. She's our first batch. All right. And she's currently a PhD scholar at Kyoto University. Right. Then we have TS Tajul Asni Ahmad. Mr. Tajul is our current IMU MHIA student. He's currently in his final semester. I'm sure he has a lot of interesting story to share with you if you wanted to know, about the program. So he has a lot of interesting story that he can tell you. And he also a very interesting background. He is a health tech entrepreneur and a venture builder. So later I'm going to ask Mr. Taju to explain a little bit about his background. I'm sure you want to know, this chap is not from a healthcare background, but he's willing to make a move into this. So I think we want to hear from him. And next we have Dr. Muhammad Irfan Yassin bin Ali Ubi. He is a very famous family medicine specialist under the Kementerian Kesehatan, and Dr. Irfan is graduating. So Dr. Irfan has completed his PG diploma in health informatics and analytics, completed everything, and is due to graduate in our upcoming convocation in November. So, if you just by hearing the speakers, you already know, the reason why I bring all my three important speakers to come here, because they have gone through the various stages of MHIA, uh, Noraini being Dr. Noraini being an alumni and who has done her MHIA last year. I'm sure she can share a lot of story with you. And Mr. Tajo, a current student. Then we have Dr. Irfan, who has just finished everything. And yeah, we're going to get all three of them to share with you their experience. So I'm going to start this session by maybe putting the first question to Dr. Noraini. So, Dr. Noraini, you have very interesting background. From what I understand, you come from Kementerian Kesehatan. You are already at, a healthcare facility management level. So I believe coming into MHIA is probably something totally different for you. Maybe you can share with our attendees today, like, why do you want to choose this path, or maybe why do you want to even come into IMU to join MHIA?
Yes, actually, that's a. By the way, thank you for inviting me. I feel honored to be here tonight. I'm a bit nervous though. So I'm actually a medical doctor with the Ministry of Health. I did housemanship. I went to do my medical officer time in a rural district hospital. I climbed up the ranks. And somehow I ended up in hospital admin. And yeah, it was like the turn of fate kind of thing. I never planned to become an administrator. But in that hospital, I became a hospital deputy director. And then after that, I joined the Ministry of Health headquarters to become a policymaker. And after that, I actually did masters in healthcare administration in Nagoya University, Japan. So after returning, I became a hospital director. I became a policymaker again. And that was when I discovered Tajul's world. Because I was dealing with the private healthcare industry. I was dealing with international trade and the industry itself. And I was seeing a lot of interesting things going on the industry side, but it's not really visible from the ministry's point of view. So that was when I figured that maybe I should do something different. So that the MHIA advertisement actually came up on my Facebook, and I impulsively just registered for it because I felt like this is the future of healthcare, whether you like it or not. It's going to hit us sooner or later. So that was basically the motivation why I decided to do MHIA. But I have a lot of friends asking me, Nuni, by the way, people call me Nuni. You have been there. You have done a lot of things in policy. How come you are changing your field to do MHIA? And it's a new field that is not officially recognized by the Ministry of Health yet. So that's a question that I always get from my colleagues, from my juniors. But I think it's an interesting field to explore. And now I'm with the Kyoto University, the Graduate School of Informatics, to do PhD in medical informatics. So I'm currently attached with the IT department of Kyoto University Hospital. So yeah, back to you, Dr.
Thank you, Dr. Noraini. So I want to dwell just a little bit before I move on to Mr. Tajul. You come from a medical background, and now you're doing a PhD in medical informatics. That sounded quite technical for me. How is that? Like, you come from a total medical background. So I'm referring to MBBS background, and now you are in informatics. Can you explain a little bit, whether that transition has become a challenging transition for you, or does MHIA actually help you to have that stepping stone?
Oh yes, that's MHIA really helped me a lot. I remember when I first learned Python, that Actajal we're like import pandas SPD. That's all we know. And the code that we know is like hello world is all the time. But I find that MHIA really prepared me for this journey because here we are doing even though a lot of things are in Japanese here, but when they are speaking about the programming stuff, I do find it an advantage for me because I did MHIA before and I've learned all this programming stuff in MHIA. So even though it's I wouldn't say that it's hardcore programming, but if you want to explore in details on how to do stuff on Python, there's always Tech Exchange and other online help, helpline, website that can help you. But the MHIA requirement, I would say that it gives you this the solid foundation as to what you're supposed to know when it comes to basic programming. But it's up to you on how much you want to explore further.
Yeah, thank you so much. And it's quite comforting to hear that, our program, although it's just 1 year program, but I think the program has been like intensive enough to equip you with the right skill that for you to move on to your PhD. Thank you, Dr.
Yes.
Noraini. So we're gonna move to Mr. Tajul. Very interestingly, you probably can explain to our attendees that, what's your background. You're definitely not a medical person, I'm very sure. So we want to share with your attendees a little bit, how's your background like, and why do you come to IMU to do MHIA?
Oh, okay. Thank you very much, Dr. Yam. First of all, thank you for inviting me as well to become one of the panelists. I feel very honored to be among the other distinguished panelists here. I'm still a current student in MHIA. Hopefully to finish my papers soon. Inshallah, this is my final semester. In terms of background, you were asking me about my background. Okay, I actually graduated from another private tech school in Malaysia. All right, 22 years ago. Right, so I graduated in electronics engineering, majoring in multimedia engineering. So and I started work as a as a systems engineer, network engineer, DBA, and all that in my first few years. And then I moved into several multinationals based out of Malaysia and some of it in Singapore. These are like the IBMs, Oracles, and the SAP was my last attachment up to 2015 lah. All right. So between I would say from 2008 from 2008 up till now, I've been very much involved in the healthcare sector, coming from the technology side, right? So I've been advising, supplying, implementing, project managing technology upgrades in several hospitals in Malaysia. At advisory level, I also provide consulting services, which actually brought me to starting my own health tech consulting company in 2015, right? So I was thinking that, yeah, I've been doing this a lot on the field, coming from a technology side and all that, liaising with all the clinicians, doctors, alike team, like health team and all that, and the management team and all that, right? So I've been doing it in practice lah. But I feel like, I need to get something, I need to get some academic qualifications to support my work, right? So that actually one of the motivation for me to enroll into MHIA back in 2021. That was during the pandemic, all right? So the other two motivation was because my kids their studies were haywire during pandemic. So I was like, I have to do something. I have to set an example, that say that Papa is studying, so the kids also have to study lah. I have lots of classes. Nuni knows our first semester was crazy. Saturday and Sundays and all that. But I tell you, the experience, even though I've been in the field and all that, the experience that we go through, the knowledge that we get, the team, basically the students, the mix of students that we have coming from various backgrounds, from the clinical side, from the management side, myself from entrepreneurial and technology side and all that. Some coming from even allied health, psychology, pharmacy. I think it's very enriching, and I think this is the future. To depend on the pure breed, if you're a clinician, you're only doing that. I think you probably need a bit more, understanding your data and all that. I think these are the true niche or benefit of MHIA, right? So that's a bit. Yeah, that's some of my background. Do you want to hear more or what?
It's okay. Let me dig more. But
Okay.
yeah, but thank you so much for sharing your
Yeah,
background, and you actually mentioned that you come from quite technical, not just
yeah,
technical, but you also have a lot of experience with consultancy and
yes,
stuff like that.
yes, yes,
So obviously you don't have a pure medical background.
no,
So now that you are like almost completing, you have gone through all our courses, all our modules, and this is like the last one where you're doing your research currently. Now, do you
correct.
think the courses that we have been offering, from semester one itself, is it very helpful for you to understand the entire landscape in healthcare perspective?
I think it does. I think it does. It brings a bit more perspective and objective into the things that I'm doing, right? Because if you come purely from technology per se, you want to do data cleaning and all that, you have to understand what data that you are cleaning, right? So you got to refer to the clinicians. They are more experts in the domain to verify that, okay, this data can be cleaned. This data we don't need. Which one is more important? Which one is not, right? So I think, like I said, the experience of it when we are working in a cross functional team, cross multi-discipline team is very enriching. I mean, technology and all that, sometimes they just purely ignore. We just simply deliver the app or deliver the application. But then if the clinicians are not using it, or they feel that it's not useful for them, it doesn't work, right? So for me, if you want to call yourself a consultant, you got to understand both sides. You got to understand the clinical side, the practice side. You got to understand the technology side. You got to understand the business side. What does the business want? You
Mm,
see, right?
mm,
So I think it definitely has it's added advantage like in that sense.
Yep, good to know that. I'm actually very happy to hear that, some of the modules that we have offered somehow is very helpful for you, even currently as for your business. Thank you. Uh, before we move on to Dr. Irfan, I want to have one question. I want to talk about, the part that you mentioned that when you have in your class, if you still remember, even like now, because you actually
Yeah,
you are actually a full-time working person, but you actually join part-time. So,
right.
Mr. Tajo and Dr. Noraini actually joined together, but
Yeah,
because Dr. Noraini did it as a full time, so she completed like in 1 year. And then Mr. Tajo, this is your second year, right?
yes,
I'm sure like, as a working adult, okay, time is what we have. So it's fine. We can take our own sweet time to finish. But in these 2 years, I'm sure you see the dynamics in the class. I
right.
believe, I'm not sure if you will agree with me, but even as an academic staff, when I teach in a class, I feel equally motivated because I have a different background. So when I go into the class, I see students come from different background, and as well we bring, we manage to bring our discussion to a next level. So for
Mm,
example, like, I teach a lot in research methodology,
mm,
and what
mm.
I like a lot is that when I prompt student to ask question, everybody will just start giving a lot of input that comes from their background. And even as an academic staff, I feel that I learn so much even from student. So do you have the same feeling as I do, Mr. Tajo?
Definitely, because I think I had the opportunity to go two batches, right? From the first batch and the second batch. The first batch, we have a group of students which was already multidisciplinary at that point of time, all right? And it was the first time we were running the program and all that, so I would understand in terms of the time management, the classes, the submissions and all that, in terms of the content as well. But I noticed that coming into the second batch, uh, yeah, it's a different group of people, but I feel that the tempo has been up a bit, right? Probably experience from the first batch going to the second batch, tempo has been up. Hopefully, thankfully, I was already, prepared for it, and I didn't have that many modules to complete because I spread it almost equally across 2 years. And definitely the contents as well as has probably greatly improved across the batches lah. That's how I see it.
Yep.
Mhm.
Thank you for that. I think it's also a very important reminder for our potential students that they need to understand the expectation, which I'm going to talk about it later. But I want to also quickly jump to Dr. Irfan. So, Dr. Irfan, you have a even more interesting background. You are a full clinician. So, from when I spoke to you, you are a family medicine expert, and you actually see patient. So how do you come from fully clinical background? I would assume that you have really zero digital background. Programming, I think, is zero. But you have done it so well. Can you share a little bit with our participants here? How do you do it? This is totally different end of the extra the spectrum. Like we're talking about from clinical, totally clinician, and then you move all the way to technology.
Yeah.
Maybe you can share a little bit with us.
All right. Thank you for inviting me, Dr. Yam. So maybe this is quite interesting topic actually for me. The last question, the last person to answer your question, because I'm the one that using the all application on the field. So this is when I remember how do I start the journey in health informatics? Because I'm already working for 23 years, 1 year more than Tajul. So start back from the I'm graduate from Royal College of Surgeon in Dublin, Ireland at year 2000, and doing my house my at 2001. Mainly I working in Sarawak, in hospital, district hospital, and also in clinic. So mainly in the during before, but I'm taking the because I'm taking the master in family medicine, specialist in family medicine at year 2008. Before that, I working mainly in the hospital base. So during the hospital, I'm doing administrative and also clinical. So I'm mainly purely clinician actually. At the initial point that I start using the we call that tele primary care electronic health record at the year 2003. This is the first hospital in Malaysia, in Sarawak, that using the primary health clinic, mainly in the hospital, and also cater the outpatient department. So it's only for 1 year I'm doing that, but after that I'm transferred to Hospital Sarato in the center of Sarawak. So then I want to be a specialist. I also love to do admin. So that's why I entered to join to become a specialist at University Kebangsaan Malaysia, and I graduated at 2013. Then I lost touch in the computer science everything. I'm actually no good at all using computer because my time during 2000, I remember during the medical student, I just got the free laptop from my university. That's the first time that I received computer. I don't know how to use at all. So I learned from friends actually. But after 2013, I'm been graduated. So I've been transferred to Klinik Kesihatan Sempurna Sabah. This is the second phase of electronic health record in government clinic. So we are using the tele-primary healthcare. So I'm getting into it more detail. I've been invited to be one of the mentor to develop a new system, tele-primary care, oral health and clinical information system. This is upgraded version of TBC. I was involved in many research using the statistical analysis, doing research, and also involved with the health financing. They invite me for case discussion about drug-related group, all the things about health financing. So I'm going into it because it's changed after the COVID-19. You can see that during COVID-19 at year 2020, I don't have there's some issues of risk of transmission, especially going to the clinic. So we need to develop new system such as visual consultation. Allow the patient not to see a doctor, but only using the during that time we are doing system using book docs apps application, and also just calling, and some of the clinic using Google Meet. So that's why I'm thinking the way that we see our future at the moment, we need to integrate health informatics to our clinical care of a patient. It's either by using the visual consultation or using any application such as MySejahtera. You all know about MySejahtera, or using the appointment system, and also we are using the any artificial intelligence that mostly I learned during my education in International Medical University. So it's brought me all the aspects that are familiar to the patient care. We all know about smart technology, everything for the elderly. But I think for your info, I'm the first family medicine specialist to join this course. So everyone asks me, why do you do this? Then it's very weird, and it's very I can say it's stressful for me, but I enjoy working for all of you with good team. It's okay. We need to learn. I managed to complete for this diploma for 9 months, struggling, but it's okay. It's fun to learn new things, and I hopefully I can adapt and adopt in my clinic.
Yeah.
Because that's the way we go. All right.
Thank you so much. This is such a motivation. I'm sure in the midst there are quite a number of doctors who are, or maybe if you're in clinical, whether you are a pharmacist or even you're a dental officer yourself, I believe you probably see that, how do we actually, as a clinician ourselves, like we don't know anything about technical, then suddenly you have to jump on to this wagon that everybody talk about digital now. So whether this program is suitable for you, I think Dr. Irfan answered it very well that obviously this is what it is. Of course, learning process is challenging. So actually, my next question comes about actually all three of you are working adult, right? So yeah, remember all three of you, you didn't stop working, right? Unless you do, but not that I know of. All of you have family, your father, your mother, just like all of us. How do you cope? It's such a challenging thing to full-time working and full-time to study as well. So I'm going to direct this question first to Dr. Naraini. You are a full-time manager, administrator, then you are a full-time mom. You are also a full-time student. Actually, how did you manage to actually do that? So maybe you can share with us a little bit, how did you struggle and survive during that time?
Well, at that time, I was actually managing a COVID facility. I was, dispatched to manage a COVID facility. So when I signed up for MHIA, I asked my husband, can I do this? And then he's like, it's up to you because it's your life. You want to study, go ahead. And then I was like, yeah, but if I were to do this, I need the weekends to myself. So my husband has been very supportive, and when he was not able to look after the kids during, I have two kids, by the way, two school-going kids. Now they are 8 and 9 years old. So last year they're slightly smaller, 1 year smaller, younger. So when my husband was busy during the weekends, I would go to my parents' place. So I would lock myself in the room to attend the lectures, and my my parents and my brother and sister had to do the babysitting of my kids. So it was quite stressful, but if you get the good support from your family and you can manage your time well, it is doable.
Yeah, I agree with you. Maybe we go over to the father. So what do you think, Tajo? I'm sure you have similar struggle, just like a mother, I'm also a mother, so I understand you have a similar struggle as well.
Yeah. Just don't miss your kid's birthday or your wife's birthday. I think that's the most important thing, right? Family has to come first. And when it comes to studying, it's really the family time that you're actually sacrificing, because the classes happens on weekends. When
Mm,
we started back in 2021, it was during the pandemic lockdowns and all that. So all classes were online, right?
mm,
So like Dr. Nuni was saying, that we all lock ourselves, Saturday and Sundays, 8 to 6 p.m. kind of thing. Not to scare you guys, but but that was during the pandemic.
mm.
And yeah, I think you have to have the support of your family members. You got to tell them that I want to do this and why I want to do this.
Yep, yep,
It's definitely something that's very valuable. So they have to understand and be supportive, lah. So, yeah.
yep. Thank you. So, Dr. Irfan, I think you have similar story as well, and you were doing
Mhm.
clinic work at the same time. So, how do you do it?
So I'm just being lucky because during the first 9 months, I get sponsor from government to continue this study for MU, but I need to transfer to Kuala Lumpur because my place of working is Kuching, Sarawak. So I applied through government. So then I need to separate with my family. So I stay here. But definitely during the Monday and Friday, I need to work as usual in Ministry of Health. But the class good about IMU, the class most of it at weekend, so I can compensate my time. One of the things that sometimes we do online. So I remember that every month I have to go back um, minimum twice to Sarawak. So I book earlier flight, so you can get cheaper flight. So then it's okay. So but during that time also I have a class during online. So I struggle a bit to do all the assignment, assessment, everything. But luckily when I working, so I'm working with the team of in the tele primary high care. So they are good in term of IT and also programming. So I work and learn from them. And also, um, although I mentioned just now it's quite stressful, but if you have a good team, a good lecturer, and good study group, I think you can do it everything.
Yep, yep,
But you need
yep.
to support of your family. This is important thing. I have a family here.
Mm,
In Kuala Lumpur, I have my sister there, so
mm,
I don't have issue about house everything because it's
mm.
difficult for someone outside to just come to IMU every week,
Yep,
every weekend,
yep.
to attend the class. Some of my colleagues actually from Penang, they have to travel to
Mm,
Kuala Lumpur. They have to
yep,
book hotel, transportation, everything. It's a bit troublesome. But
yep,
for me, I just been lucky because all my sister is here in Kuala Lumpur. So,
yep.
but just weekend, I go back home.
Mm. Thank you so much for sharing that. I think, yeah, it's actually quite overwhelming when we hear, how our students actually quote unquote sacrifice their time. But I guess maybe this question is more suitable for Dr. Noraini. You have graduated, so the feeling is great, right? I mean,
Yeah,
yeah.
definitely.
I mean, yeah, this is, we understand, we ourselves as academic staff, we see our students, how, even we work on weekday too, but when we come on weekend, the main motivation for us as an academic staff to come to the weekend to have classes is the same, also because of the student. When we see them equally motivated, there's no reason to stop me as a lecturer to not coming. So I think it works both ways. So I think, again, being in this program also mature myself as a lecturer, because I learned so much from the student. I even learned the motivation level from the student, and that is fantastic. So yeah, you work through a very difficult thing, but you graduate, and that is probably the best feeling of the world. But like Tajo, for example, Tajo, extended all the way to 2 years. So I think, it helps you to also space. Like I said, we are all adult, we are working adult, we have our life, we have commitment, we have children. So we take our time. So as long as you're not rushing for your scholarship, then I think you have time. So we are okay. And you don't exceed the maximum duration. Lah. We
Well,
have a maximum duration.
to,
Yep,
to be
sorry.
honest, right, I actually wanted to extend. I wanted to convert to part-time because of the stress. There was
Okay,
one time I actually thought of that,
but you
because
didn't.
when you do part-time, you can actually choose which module you want to do for that
That's
semester.
right. That's
So
right.
I was thinking of cutting down the modules so that I can have more time with my family. But
Mm-hmm.
it was the support by my classmates and the lecturers that actually kept me going, because Dr. Yam was always pushing me, Nuni, you have to do this. You have to graduate on time. So, and my classmates, they are like, okay, Nuni, it's okay for this assignment. Let's us, distribute the task. You do
Mm.
this, I do this, and then we come back together. So the
Yeah.
support was really good, the teamwork. So
Yeah.
that's
Thank
what kept me going.
yeah. Thank you for the reminder. You also reminded me that because our master and also, I mean, our postgraduate program, majority are working adult. I would say probably 90% are working adult. So the expectation to come in is like, it's just like working, it's like a working environment where we depend on each other, especially when we have group work, we depend. So it's like a working environment where we're helping each other. And I'm so happy to actually see the dynamics with the cohort. Every time we look at a student, we will say, oh, they're going to be fine, they're going to work well. And of course, like, when you're tight with deadlines, we understand it. Like I say, we are working adults. We totally understand. All you need is just to let us know, and we will try to be flexible as much as possible, because our aim here is very simple. We want to help you to achieve what you want. Our job is not to bring you down. If we bring you down, you shouldn't come to IMU. But we as IMU lecturers, our job is to support you. So when you have this big dream that you wanted to graduate, this is our job. We will push you through. We will help you. We'll give you whatever support that we need. Hopefully, you graduate with A star. That is what we wanted. Yeah. So maybe just one more question, since we are talking about this workload and stuff. With all the workload and everything that we've discussed, right? Actually, how does it help today, in your current work? Like for example, like Tajo, you're still in your company, your health tech company. Just now you did mention that, some of the background that we feed, it actually helps you a lot, in moving your company. And I also know that you personally also supervise a few undergraduate students under your charge that help them to move into the entrepreneur part. Do you think that, how we have crafted our curriculum somehow bring you up as well, as a mentor yourself for this younger generation?
Yeah, I definitely. Like I'm already getting offers to do consulting from international companies to, help them in terms of the industry, health industry, technology industry. This credential, hopefully I'll be able to obtain it soon, is definitely going to add up to my overall career advancement, right? So I'm like you mentioned, I also do mentorship to apprenticeship. I call it. I don't put it as internship. It's apprenticeship in entrepreneurial endeavors for young graduating students
Mm,
who like to move into entrepreneurship and start their own health tech company, med tech company, right? So
right.
so so I come from that angle mostly. Yeah.
Mm. But and since you are more in the tech, in Malaysia, you are more in the health tech and all, do you actually foresee that this health informatics and analytics or this digital health thing is going to go downhill, or do you think it's just going to it's going to boom up in the next few years time?
It's one of the hottest things. Health tech and med tech is one of the hottest things across the region. I can tell you that. There are many investors looking for companies, young companies. In fact, one of my startups actually went into an accelerator last year under the
Wow.
Selangor Accelerator, and we were a grant recipient in one of our projects, in the health tech projects.
Wow.
I tell you, the opportunities are endless. If you are a young graduate, coming with a clinical domain, health science domain, or technology domain, if you can marry one or two of those together, I think it's explosive. It's high in demand, definitely.
Wow, thank you. I hearing from the technology point of view. I mean, it also makes us feel like, oh, okay, I think we are doing a good job. Thank you for that. But what about you, Dr. Irfan? Since you are more into Kementerian, you're more from Ministry of Health perspective. Do you think the Ministry of Health in Malaysia specifically would go into this direction, or they're just gonna stop here? What do you think?
All right.
Any inside
Thank
news
you.
that you can share with us?
Definitely. But I just want to add one more thing. Actually, I initially actually started with a part-time student, but I convert to full-time for 9 months because I have to finish my sponsorship for within 1 year. But I managed to do it. It's nothing possible in the health informatics actually, because you are working in the excellent people. So in Ministry of Health, at the moment, actually yesterday I've been invited to give a sharing of my experience regarding the health informatics in the community of doctor, mainly a family medicine specialist. So we give awareness regarding what is artificial intelligence and HI, and also we sharing the pilot study that been done in Ministry of Health. Is all about the ophthalmology point of view and apps application. It already starting the developing the digital health apps in the community. I know, but it's a bit slow. So we need have some community to promote it. Because in my community, in the like say in the Ministry of Health, there's a few people that already have a PhD or degree in Ministry of in Health Informatics, that they are stuck there. So we are because I'm the most senior. So I actually plan to maybe we can create something mainly in the medical field, and I'm more interested to do in chronic disease such as diabetics and application and everything. So hopefully we can work and create something new. So apart from that, I'm also been invited by the last week University of Kebangsaan Malaysia to develop apps for leptospirosis. So all the things, it's new things for me because when you want to develop apps, there's a protocol that you have to follow. I'm still
Yep.
learning about the
Yep.
protocol, but
Yep.
we can put our knowledge to that because
Mm,
when they ask about that, they
mm,
don't know about data security, data governance because they are purely medical doctor. They have
clinicians. Yeah.
knowledge,
Yep.
but we are the one that can give input with
Mm,
the IT software to be part of the team. So I think
yep.
it will boom, as Tajo said, but it takes time. But from the government point of view, they
Mm,
develop few things, blueprint for the fourth industrial revolution, the
mm,
guideline, the digital
yep.
health guideline. I
Mm,
think it will shoot up or speed up. All
mm,
I think more than maybe less than 5 years.
yep.
I think it will
Wow.
go forward.
Wow, amazing. So that means in the next 5 years time we are gonna see that Malaysia is gonna move into this line along this line. So if we want to like hang on to the wagon, I think we better be fast, equip ourselves with the right skill and also right knowledge to move into that. So Dr. Noraini, you're in Kyoto. Will be interesting to know from the other side of the world, how does it like, is this health informatics thing or is this medical informatics thing, is it going to stay or it's not going to stay? What you can you share with us a little bit what is going on in Japan, or how is it going to impact this side of the world?
How it will impact that side of the world, I'm not so sure. But I do believe that one day healthcare is going to be borderless. That's my personal belief. So it's definitely going to affect the rest of the world. So what's been happening in Japan is that I've been exposed to that they have like Japan Association of Medical Informatics. They have associations for that. They have regular conferences for that. So apparently in Japan, even though we are not aware of it because all their publications are in Japanese, they the medical informatics or health informatics field is quite established here. And interestingly enough, this is the first time I'm in an environment where there are more males than females because in my lab, we call the department lab. So it's not really a lab, but the department where I'm doing my research in. There are a lot of engineers, so there are more males. There's also allied health people. There are also nurses and as well as medical doctors. And the way they're approaching medical informatics is really interesting. They're looking into AI, motion detection in the operation theater, how to prepare for earthquakes, stuff like that. It's like really eye-opening for me because I never thought that it's that extensive when it comes to health informatics.
Yep. Thank you for sharing that. Really, in fact, the last few months it has been like tremendous for digital health development in Malaysia also. We can starting to see that some private hospitals are moving towards digital transformation. They start with just very simple patient medical records, and then from there they even move into like medical imaging using AI to interpret their medical images and all. Now we're even talking about smart hospital, smart rooms, where you probably don't even, we still need nurses, of course, we still need human intervention, but having technology, it actually assisted the entire process. So I think that is really amazing. And coming from a digital background, people, that actually help us to understand a little bit more. And maybe before we move on, we want to jointly welcome Prof. Shankar. Thank you so much for joining in from New Jersey. This is like a totally opposite time zone for you. Good morning to you.
Thank you. Good evening, and I'm very honored to be here as well.
Thank you, Prof. Shankar. So we have Prof. Shankar, who is the chair and professor of Department of Health Informatics from Rutgers School of Health Professions. And today we invited Prof. Shankar here for him to share with us a unique pathway that we're in a very active discussion now with Rutgers for our MHIA student to continue to doing their doctorate. So I'm gonna pass this time over to you, Prof. Shankar, for you to explain a little bit about our relationship and how are our master students going to proceed over if they are interested to do their doctorate in Rutgers. Yeah, over to you.
Sure. Can I share my slides, or would you
Yes.
do you want? Yeah, sure.
Yeah,
I'll do
please
that.
go ahead. Thank you
I'll
so
do
much,
it.
Prof.
You're welcome. Thank you.
All
Can
right,
you
we
see
can.
my screen?
Yes, fantastic. We can
Perfect.
see your
Oh,
main slide, so
thank
you can
you.
move on. Thank you so much, Prof.
Thank
The
you.
time is yours. Thank you.
Thanks a lot. Yeah, I'm very excited and honored to be here for sure. And thanks, Dr. Waikiet, for this warm welcome. And I've had the privilege of having met many of IMU administration recently at at Rutgers as well here in New Jersey. So it has been an exciting development, partnering with IMU, and we are beginning to explore various educational and research collaborative ventures. And the Doctor of Health Informatics is one of those ventures that we started off with, and which I'm going to explain about what the Doctor of Health Informatics is very briefly, and then talk about how IMU graduates can benefit with this partnership that we have been talking about. So the Doctor of Health Informatics is a practice-based doctorate program which places a greater importance on evidence-based explorations. I think Dr. Noraini was talking about her desire to see that it's like a borderless data sharing and such. And this is something that is forthcoming, that is very forthcoming. And already in the US and in Japan, in many of these countries, there has been a whole lot of data collected over the years because the onset of the electronic health records, and because of which they have been able to bring themselves forward into doing coming up with health informatics applications and even developing apps which are very effective and so on. And our point about like her desire being borderless is very much more of a requirement now, because as you saw even during the time of COVID, there is a need for data to be shared to know whether this vaccine or that therapy or this surgical technique will work in that population somewhere in Malaysia or in India or in China. So this is much of a enterprise that is going to be, as like Dr. Tajul also mentioned, this is going to be something that is explored in the coming years. And here in the US, the Bureau of Labor Statistics, which is the official labor department, they have projected a 30%, 28% growth over the next 10 years, which is very, very high. A typical profession would see probably 12% or 13% in the developing economy. I mean, growing economy, but 28% is a lot, So there's a lot of exciting developments in the future. And I'm so excited and honored to be partnering with IMU over these ventures. So I'm going to talk about the Doctor of Health Informatics. As I mentioned, it's a practice-based doctorate and evidence-based because it is based on data having been collected and to be explored. And it is a 54 credit, which runs roughly into a 3-year duration for international students, which is more of interest to the attendees today. And it has 3 tracks, and I'm going to concentrate on one of the tracks just to give you an idea of the arrangement of the courses and the nature of the courses as well. As you can see, it is spread over 3 years, fall and spring. Fall in the US in our university runs from September to December, and spring runs from January to May, and summer months are like June to August. Okay, so fall and spring makes up 1 year. Fall and spring again makes up another year, and the fall and spring is the 3rd year, is when the international student will be working on a doctoral project. And the purpose of the doctoral project is to come up with 2 manuscripts for publication in a peer-reviewed journal, because it is not just doing something that satisfies the doctoral project committee, which says, yes, you're doing a phenomenal work, but also to get peer acceptance from the community outside, from the professional community outside. And I think Dr. Noraini and I'd mentioned about the Japan Medical Informatics Association. We have the American Medical Informatics Association, which many of you who are practicing health informatics would be familiar with, and which runs conferences and meetings and such. And they are, besides that, there are plenty of conferences and journals as well. There is opportunities for the students to submit their manuscripts and get them published. But it's not a requirement that they get it published, but that they submit it for publication, because many a time, as you all know, it takes a considerable amount of time to get it published. But this is a criteria that we want our student, when they graduate, and which has been proven already, when they graduate, they get on to jobs that are in the industry, and they get on to do very well, because with a doctoral degree, it's more likely than not, then somebody will be in the more of a research area or in the consulting area and such, and having this knowledge of how to publish, how to report your projects, and how to present it in an effective manner and defend questions, and your your logic is very critical for proving oneself in the workplace as well. And as you saw from the previous slide, the nature of the courses are all to do with state-of-the-art software and techniques. And this is just a collection of the software and the techniques that we talk about or teach in our doctoral program. And just so if any of the attendees do not come from a technical field, please do not feel concerned or afraid or challenged. It may be challenging, but not to be afraid, because I can assure you, over the past so many years that I've been the program director for the program, the kind of students that we get into our master's program and in the doctoral program are all from medicine, from dentistry, from nursing, biotechnology, a few PharmDs, a lot of PharmDs are there, and very, very few, I would just say a handful over the past 20 years of engineers or computer scientists, because of course they have their own growth oriented areas in their own fields. But in this area, these applicants from all these non-technical fields have gone on to do extremely well, having gathered the information from our program. As Dr. Irfan had mentioned, he had been using IT techniques as well, besides being a medical doctor. And that's what we have the advantage of. We have all these clinically smart professionals. All they need is to grasp how these like software or techniques can be helpful for their work, and once they know that this needs to be used for this application or that application. That is a difficult and a challenging task for anyone coming from a technical field, because they may not know the context. They might understand the context of healthcare, because all of us per time, are concerned about our own health, but they to come from a clinical field, which is more tougher, and then to have the knowledge of a software and or a technical algorithm or whatever to apply for what they are exploring is a distinct advantage. And that's where our students thrive. In fact, kind of jobs in the hospitals, in the pharmas, in the contract research organizations as consultants and so on. So this is the exciting thing that I want to talk about, that this is just the beginning of a long friendship in the in the very near future, extending into years and years. And what the benefit of IMU graduates from the Masters of Health Informatics and Analytics program, what will they be able to avail of is a savings of 9 credits. Of 9 credits, roughly 3 courses, which comes to roughly around 10,000, just the tuition alone. I'm talking about, forget the residence and the cost of cost of living costs and so on, and also a semester worth. Because when you saw the curriculum, the arrangement over 3 years, you're reducing that to 2.5 years, and you can speed it up further by starting or embarking on the project ahead of time. And most of our students are able to do that too, so that when they are graduating, they are doing so with having 2 papers submitted or even 1 published, and they are ready to find a job. And also our program, if many of you are familiar with the concept of STEM, ours is a STEM program, which means international students can avail of opportunities for OPT, optional practical training, and also CPT, like curricular practical training as well, which enables them to stay in the US if they wish to gain practical experience in the industry outside, and then decide what they wish to do for their future. So the 3 courses which will be transferred based on the students' background, like each one of you has have graduated or who are about to enter the program, you have your own strengths. So it is we go on a case by case. So a lot of flexibility exists.
That is fantastic.
And the admission requirements are very straightforward. As in any typical doctoral degree, we need a master's degree. Of course, the GPA, on this kind of a scale. So when you get the course by course evaluation, at that time they will put it in the form of the GPA if it is not in the GPA format, and we will know. And we do require the course by course evaluation for any degree that's not earned, the last degree, that is a master's degree not earned in the US, so they need it. And then a CV or resume, no GRE at all. We don't believe in GRE, but we believe in your CV and what you bring to the table or bring to the program. And we want our students to thrive and to gain from the program, And international students do require a TOEFL or IELTS. I need to confirm whether Malaysian graduates also need this. I do know many countries are exempt from this requirement, but I can check for that too. And the typical deadline each year is April 1st of each year. So quickly, I'll summarize and leave it to Dr. Vaikiat to open up the Q&A session. So it's a 54 credit degree program. Our on-campus mode, we have also got an online mode, which is very popular with local working professionals. As many of you were discussing, I could relate to it, and I'm very proud of all of you who work and do and study, and manage your family and all the events that take place in all of those spheres of your life. I'm really, really kudos to all of you, honestly, because I feel for every single student who joins our program, be it the international student who come there with their own challenges, and even the local students who have work and family and everything else to take care of. And it's a challenge. So I'm only talking about the on-campus mode here, which is a STEM-based program, and we have a faculty of around 20, with different, very eclectic mixture. Dr. Vaikiat is very familiar with the arrangement of our faculty, and we I have always placed a lot of importance on hands-on software experience. We don't just make you learn some theory and go and explore and come back with your solution. We don't do that. We still teach like the school based thing, but except that the progression of the course will start from scratch and then quickly build up speed, and so that we know that you can meet the challenge, and people have proven themselves in the past too. No prior knowledge of computer program is necessary. If you have knowledge of Python or good with biostatistics and a combination of both, you will do extremely well. Just so you know.
Thank you for that. Thank you so much, Prof. Shankar, for sharing with us. At least we are very happy and very proud, to know that our IMU MHIA graduates in the future, they could have credit transfer, and it's not just one or two, but we're talking about 9. That is a lot, and that's like a big saving. And this also opened up a lot of opportunity to students who are very interested to do doctorate in US. And yeah, this is a very good stepping stone for you, if you're interested to move on to the US and to study, to learn from the expert. This is really the good one. Thank you so much, Prof. Shankar, for that. So I do see that we have quite a lot of questions, I would say, on the Q&A. I'll try my very best to answer each and every one of them. I'll start with the first one. I'm a very busy manager in a private healthcare center. Would you advise, is it better to study part-time or full-time? What is the difference? Okay, the direct answer will be, please take it part-time. Why? Because what is the major difference? Now, full-time student and part-time student, they study together. So if you can imagine, if we run seven modules in one semester, for full-time, you have to take all 7. But as a part-time student, you can choose to take only 2. Then you can choose to take only 1 in the next semester. So the difference is that if you are a full-time, you take everything when it's offered. This is why we can assure that you can graduate in 1 year, because you need to complete all 40 credit hours if you're doing masters. If you are doing PG certificate, then it's 20. If you're doing PG diploma, then it's 30. But if you're doing masters, it's 40. So to ensure that you graduate on time, full-time, then yes, you have to take all modules when it's being offered. So take part-time. You will have a longer duration to complete. If I remember correctly, you have up to 4 years to complete, or is it 6? I sort of like confused a little bit. I think you have up to at least 4 years to complete. But in our plan, we usually will recommend you, to complete maximum in 3 years, maximum if possible. Because if you take too long, because we're in a digital and also technology degree, we usually will not recommend you to go anything beyond 3. But if you are, you're really very tied down, you cannot give in so much, then we will say, just take the maximum time that you can do. I hope I have answered to that. If I have not, please let me know that if you have not. Now, the second question, can international student join? Of course, we welcome international student. In fact, this year we have a special bursary just for international student. But as part of the international student requirement, visa requirement, you must join full time. So this is a requirement in Malaysia. If international student wanted to come to Malaysia to do their postgraduate, you must do full time. So for this, please contact our admission staff. They will be able to attend to you. But please come in. Put in your application as early as possible, because it takes time to process your visa, and we plan to start in September. So, and our classes are face-to-face classes, so you are required to be in the campus. I hope I answered to that. How's the class schedule like? I think just now, I think Taju, or was it Taju or Dr. Narani already mentioned, our classes are Saturday and Sunday. Why do we arrange like that? Because we cater for working adults. We understand that as working adults, it's quite cruel to pull you out from working, right? From, pulling you out from all your financial commitment. So you continue to stay on to work. But if you could, I know some people, they have this option, they can actually choose part-time. So they probably switch to part-time. And I think working part-time is probably the best option, so that you are still ensuring that you have financial sustainable in that way. But at the same time, you also spend a little bit of your time to study. So yeah, so the schedule would be actually in the weekend. So you can imagine all our classes are on Saturday and Sunday. And is it going to be like full time in the campus? I mean, face to face. Yes, they are all face to face classes. So you are expected to attend here in IMU. So you have to come to Bukit Jalil in Kuala Lumpur for your class. So this also explained to the next person who wanted to ask, you're working in Indonesia, it will be challenging to attend class. Is it compulsory? Yes, it is compulsory to attend face to face. You have an attendance requirement that we need to fulfill. For masters, the attendance requirement is 80%. So you need to come to full time, as in you have to come in face to face. But if you're full time working in Indonesia and you're not able to attend our conventional mode, I would advise you to wait, because we do have an open distance learning mode upcoming, but not this year, not next year, is one more year in 2025. So don't leave us yet, please come back to join us in 2025, where you can do online, everything online. All right, I hope I answered to that. Are there any exams or just assignment research projects? No exam. We are postgraduate level. No more Big Bang exam. I always tell my master students, you guys are big kids. You are not small kids. We don't have to text you like that. So we are all, because it's postgraduate. So you are expected to do assignments, not only assignments, but you will have practical reports, you will have presentation and things like that. So, just imagine is 100% in-course assessment. Is that research project? Yes, you have a final year project. We have a 10 credit hour project. So this is the biggest content. No, this is the heaviest module, I would say. The heaviest module of the entire master is actually your research. So you are given one semester to complete your research. And of course, before you start your research, we have to go through the ethics committee, and then you will be guided to do your proposal. You will have supervisors to guide you. So we actually start everything as early as semester one. So imagine if you're doing a full time with us, the minute you enroll in semester one, we will straight come to you and say, come on, this is the time to plan for your master's project. And that's where we slowly guide you to doing your proposal, and then all the way to getting approval, and then finally your research as well. All right. Then what undergraduate courses can I take in order to take this master? Well, good thing, because master in health informatics and analytics, we are interdisciplinary. So whether you come from a pure science or a non-pure science, we can accept you. But we do have requirement. So if you come in without a computer science background, you will be required to take introduction to computer science and programming as a compulsory subject. Although it's an elective module, but because you do not come from a programming background, we need to equip you with programming skill. So that elective eventually become a compulsory elective for you to take on. Besides that, we also look at student whether they have statistic background. If you do not have statistic background, then you are also mandatory to take statistic, although it's elective, but you will be mandatory for you to take as a compulsory subject for statistic. So this is the two requirements that we look at. Whether or not you need to have a science background or non-science background, I think we have Tajo, we have Dr. Noraini, we even have Dr. Irfan to explain to you. We, even with their background, whether they come from a full medical background or whether they come from a full engineering background, it doesn't really matter, because when you come into IMU, we're going to start from scratch. So, all right, we're going to train everybody from scratch again. I think that is very important. So I would say that, as long as you have a degree, the entry requirement is that you must have an undergraduate degree with a minimum CGPA of 2.75. So you must have that in order to apply to enter into our program. Next question. What are the challenges that a person with nursing background would face if they decide to join this program? Um, well, I don't come from a nursing background, but nursing background has probably clinical background. Maybe Dr. Irfan, will you be able to help me to answer this as well?
All right, no problem.
Thank you.
One of my colleagues actually is nurse in my batch. So actually, although he's actually from the nurse background, but she has a PhD in statistics. I don't think so that we have an issue for nursing background to join the program, because it's the same with the clinical. You still using the one of the electronic health record. You know about apps. You know about data governance and data security. It's all the while is the same as a medical background. I think no problem. But definitely what the Dr. Yam said, because I'm starting the scratch using Python program, so I managed to do it. But
Mm.
although I also doing the statistic, because I did statistic I think 5 years back. I don't have
Mm.
issue about that because they will teach you one by one, step by step. You can do it actually. Right.
Yep. Thank you, Dr. Irfan, for answering that. To just to add on the statistic as well, we're not just teaching the basic of statistic, we're actually equipping students with R language. This is a very important language if you are really into gearing into data analytics in big data especially. So yeah, the statistic module actually allow you to learn R programming language, right? So I've answered that. The next one, among the older medical practitioners, there is a resistance towards going digital or using digital for healthcare. As a graduate of HIA, how do you convince them this is the way to go in the future? Well, I I don't have an absolute answer for you. I'm not a medical practitioner, but even as a lecturer myself, I do see resistance even from any other field. I would say that it will take a while for people to change their mindset. But the minute they see the importance and also the convenience of doing, people will start to buy into the idea. Let me give you a very simple example. Before we had pandemic, people were very resistant towards telehealth or even telemedicine facility. Telemedicine is not new. It is already in the technology is already there. I'll probably say the last 20 years. But everyone is very skeptical of using it, especially doctors. Dr. Eva will laugh. You would rather see your patient in the clinic. Why do I want to go through a Zoom or a platform to see my patient? Now, when there is no need, obviously you don't see why you need to accept technology. But when pandemic came, that's where everyone realized that, hey, I can still move on with my life. I can still see doctor, even though I'm afraid to get out from my house. But I still get to enjoy. I still have the access to um medical facility, and that is a basic right that we are speaking about as a patient myself. So in fact, I'm very thankful that we have technology. I'm thankful that we have telemedicine, because if not, can you imagine if the whole world stopped because of pandemic? I think most probably there are more people who die, not because of COVID, but because die of every other diseases. So because of that, people are more acceptance now today. So I would say that it's not going to be immediate. It will take a while. It's just like our handphone, our smartphone. If you are one of those that say, oh, I don't need smartphone many years back, today you would agree with me that you cannot get out without your handphone. And it has become so important. So it will take a while, but I don't think this is just our job as a HIA student. I think this is all of us, our responsibility. I hope I answered that, although I don't have a definite answer. Yep. Next question. Can we still use university facility to study Monday to Friday? Of course, you are an IMU student. You can use IMU facility, including our library. In fact, a lot of students love our library. They get to access a lot of database, e-database. This is the best place to come. In fact, if because you only have classes on weekend, Monday to Friday is the best time for you to complete your assignment. So please don't waste your Monday to Friday. Please come and do assignment. And academic staff are also working on Monday to Friday. This is the best time you come and bombard us with questions that you don't usually ask on weekend. So yes, the simple answer is yes. Okay, next question. If I have to miss a few class due to outstation work in overseas, will there be any recording for the class? Well, I don't have a direct answer here, and it's very tricky because our classes are face to face. So it's quite challenging when we want to do recording for face to face, unless we are in a venue where we can have like a hybrid kind of setup. So far we have been trying our very best to help our students, those who must travel, due to a last minute work commitment or due to whatever reasons. So far, what we have done is we probably change it to online class. I mean, we also need consensus from the other classmates because it's unfair for them. They already planned, then suddenly you tell them change online. It's also unfair. So before we change, we usually will also ask the class, would it be okay if we change to online? And most of the time, it works. So I think we will take this case separately. If we have a special case, we will consider a case by case basis. All right. Does university help us to find research project? Very good question. Now, although majority of our MHIA students come in with a very clear mind, they know what they want to do. right? But there are also a big percentage of students who doesn't know what they want to do. So whether we propose to them, yes, we do. So some of our academic stuff we already have our existing project. So a lot of students, when they couldn't have any idea, they are not sure what to do, they actually join us to continue the project. In fact, majority of us, they propose to us, uh, what they wanted to do. For example, like I'm not sure if I can share this. Like for example, like Mr. Tajo, he himself has his own project, working on this. So his research project actually builds on that. So it's on top of whatever that he's currently doing. So because he's a content expert of what he needs to. So our role here is to assist you. So like I say, whether we help you to find project, yes. If you don't have anything, we would help you. What I have done over the last 1 year plus is that I've actually helped students to brainstorm. I brainstorm with them, we come up with idea, we even come up with very interesting idea that no one have thought of, and then we just start doing that. And we start doing it, we were like, wow, amazing. We probably can sell the idea to Tajo later on. Is what I told one of the students. All right. The next question. What are the challenges that someone who is a fresh graduate with no job experience face in this master program? Okay. I do have this story to share. I have this particular current student in our MHIA. She is a fresh grad. She doesn't have any experience at all. In fact, when she joined us, she did told me that I don't know programming. I don't know database. I don't know what is happening. I just came from convocation. Now I want to do masters. So fast forward to today, we are almost completing a master. She is doing very well. In fact, because she's a full-time student that doesn't work, she has a lot of time to do her homework. So she actually spent a lot of time doing her assignments, and she even spent extra time to learn things extra. Now we need to be very open to you. As a university, our job here is to encourage you, and we also give you a lot of facility and also help you to understand a particular topic. But we would never stop our student to learn from outside. So sometimes we find some session to be very interesting, some webinar session, some whatever session, or maybe online classes that we find it very interesting. We will recommend to students, and they actually take their weekday time to actually study. And I think that's fantastic. It helps them to go into the continuous learning and also give them the lifelong learning kind of attitude. All right. Last question. Oh no, second last. Wow, looks like we're gonna have a lot more. Okay, second last. Is there any financial support, for example, scholarship for local student? For IMU, we actually offer some scholarship, but it's very specific to a certain group of people. So you can go to our website under financial assistance. You can check whether you are eligible for those financial assistance. So please look to the website. I don't have the latest information. My apology. The latest information is always in the website. So please refer to our website. Or if not, we have our marketing team here. We have our admission team here as well. Do drop us email. We will reply to you. All right. Last question. Oh no, second last. Will the class be full day weekend? Yes and no. Some days we do have full day, some day we have half day. Again, we are also people who work full day on Monday to Friday. By the time we work on weekend, we are half day. So we are when we plan our timetable, we are also quite mindful lah, that it's not just planning for student, it's also for us. We are also like that. So we again, flexibility wise, I would say that we try our very best to put in flexibility, but at the same time we are adhering everything that we need to from the MQA perspective. So these are some of the hours that we must fulfill, so we must fulfill. Some hours can be converted to become asynchronous. It will be converted to asynchronous for your own learning. All right. Last question. Is PTPDN available for this program? My apology. I think PTPDN is not available for postgraduate. Maybe I'm wrong, but maybe our admission staff can help me to clarify this. I don't think PTPDN is available for postgraduate, but you could withdraw from income tax. This is, sorry, not income tax, EPF, KWSP. Sorry, Salah, we can never withdraw money. There is a tax. Sorry about that. So yeah, you can seek for, you can withdraw from your KWSP if you wanted to study. And I know that there are some loan outside that you can take some loan for study loan as well. So I think that one, again, the best way is actually to go to our website to check. Last question. I'm a working doctor that needs to work at least 4 days during the weekend. Do you think I can still do full time? Well, it's really depending on you. We have Dr. Irfan. I think you're part-time, working part-time. We have Dr. Noraini, who is a full-time staff during the studies. Tajo, who is also a full-time. We also have other doctors in our student. They start off as full-time. I have a student who happened to own a clinic. He also, but he's not doing full-time, he's doing part-time. I think it's really depending on you. What I would recommend you to do is when you enroll, please enroll as part-time, because you will get to taste. So you enroll as part-time and then you have a taste, just like what Dr. Irfan did. He started as a part-time student, and then midway through he feel that he can cope and he can do it, then he convert it to become a full-time student. So that is totally possible. So my recommendation for you is that please join as part-time, and then as we go, try to see whether you can pick up the momentum. Because something that I always explain to full-time working student is that you probably have left school 10 years, 20 years ago. Coming back to study would be probably a culture shock for you. So let's not shock you. Let's not bring more stress to you. I would say try to join in as a part-time. If you feel that you can cope, then you change to full-time. Likewise, if you join us as full-time, midway through, I cannot, I really don't think I can cope, then please change to part-time. I think we are flexible in that sense, and we really want to support our student all the way until you graduate. All right. I think that's all I have for. Oh, I still have one last one. Okay, last one. We are already way overshoot. Last question. I'm on a career break at the moment. Do you suggest I do master full-time or part-time? Oh, full-time, please. Full-time. If you have a career break, you feel that I think I can go all out, then come full time. This is my personal opinion, but I don't know you. So I actually do not know, how well you take studying. As I say, if you have left school for a while, coming back to study could be a challenge. So I would say that please reach out to me. After this, I think we can share. What we can do is that our marketing staff can share with you our inquiry email. Please write all your inquiry to them. They will forward to me. You can say that, you have come to this webinar, you need to speak to Dr. Yam or whatever. Come to look for my information from the IMU website. Just, write me email and I will respond to you accordingly. All right. So we already overshoot. Thank you so much, guys, for coming and staying all the way. Thank you, Prof. Shanga. I know you have to head back to work. Thank you so much. And for our participants, thank you again for staying for so long. For those of you who are still here, thank you so much. But I want to specifically thank our speakers. I want to thank Dr. Noraini. I want to thank Mr. Tajo. I want to thank Dr. Irfan for spending your time with us. Yeah, although we just want to do 1 hour, but we overachieve what we need to achieve. So thank you so much, guys. Yeah, the chat session will have our email inquiry at imu.edu.my. So with that, I would like to end this session. Thank you again to all of you. We will see you soon. Thank you.
Bye,
Bye.
everyone. Bye.
Bye. Thank you.